In today's session, we are going to be demonstrating film placement for taking posterior periapical images. Within a full mouth series of x-rays, we will take 8 posterior images, 1 premolar and 1 molar in each quadrant. We will be using film as our image receptor, so the control panel should be set to the film setting, which will show the exposure time only. Dexter is considered an adult for today's lesson, so the adult icon will be lit. You will have to recalibrate at the control panel for each posterior image, making sure that the correct setting is chosen for maxillary and mandibular arch and premolar or molar area. Always calibrate before placing the film in the patient's mouth. We want to take any difficult images in a timely fashion in order to lessen patient discomfort. We will start working in the upper right quadrant with the right maxillary premolar image. Calibrate at the control panel for the first film, illuminating the maxillary premolar periapical icon. You can see the lead apron has already been placed on the patient. Since we are using Dexter today, the apron has been laid flat on the chair to prevent any damage. He is positioned with his head supported against the headrest. The occlusal plane is parallel to the floor, and the mid-sagittal plane is perpendicular to the floor. We're going to place the film and center it on the bite block, with the dot down, and white is right while looking through the ring. Pull the ring away from the film slightly so there is plenty of room to place the bite block intraorally. Since this image should include the distal of the canine, we want to cover with the film packet the entire canine, first premolar, second premolar, and part of the first molar. Again, being aware that the maxillary teeth are tipped palatally, we're going to put the film in flat, retract the commissure, looking through the ring to make sure that the entire canine is covered. Lift the bite block to meet the occlusal surfaces of the teeth. And close Dexter gently. The central ray should be directed through the contact area between the first and second premolars. The point of entry is the line from the pupil of the eye near the premolar root apices within the center of the ring. Check to make sure that the film is not bending against the palate and that it is parallel to the long axis of the teeth. Align the PID using vertical angulation, horizontal angulation, and bring to the ring. You can ask your patient to smile so that you can see where the film is relative to the teeth you are interested in. If there is a slight discrepancy between the PID and the ring, it's okay and should not be a reason to make the patient wait and readjust. So go ahead and push the button and use the warning signal. Clear! As soon as you are finished making the exposure, come back in and remove the film from the patient's mouth. Place the exposed film in the disposable cup on the tray and pick up the next film for the right maxillary molar image using the same XCP setup. Recalibrate at the control panel for the maxillary molar periapical. Again, center the film on the bite block, dot in the slot, and white is right. Pull the ring out slightly and hold the rod at the bend close to the bite block. We have to consider that this posterior image may cause the patient to gag, which is why we start in the front. You are trying to build a rapport with the patient and make them feel comfortable so that by the time you get to this image, by the soft palate, which could trigger the gag reflex, they may be more relaxed. Assess if there is a maxillary torus that you may have to get behind of or in front of. We're going to retract the cheek, go in flat, and try not to touch the palate until you are ready to have the patient close. In this image, We want to include the distal of the second premolar, the first and second molars, and potentially the third molar, and the maxillary tuberosity. Move the ring close to the face. Check that the film is not bending excessively and that it is parallel to the long axis of the teeth. The central beam should be directed through the contact area between the first and second molars. The point of entry is the line from the outer canthus of the eye, just at the height of the root apices within the center of the ring. Align the PID using vertical angulation, horizontal angulation, and bring to the ring. Make sure that all is parallel, and then go and push the button quickly, as again, this image can cause the gag reflex. Always look at your patient before making the exposure to make sure that they haven't gagged or moved in any way, and make sure that the tube head is not moving during the exposure. Remove the film from the patient's mouth as quickly as possible, and place the exposed film in the disposable cup on the tray. We're going to keep the XCP in the same position for the posterior exposures in the lower left quadrant, starting with the left mandibular premolar periapical. We'll place the film, dot in the slot, and white is right when looking through the ring. Recalibrate at the control panel, illuminating the mandibular premolar periapical icon. Pull the ring away from the film slightly for placement. We'll need to move the tube head over to the patient's left side and separate the extension arms prior to placing the XCP in the patient's mouth. Please notice that the patient is at a height that is very easy to work with. Adjusting the patient chair to the right height is very important to decrease the chances of operator ergonomic related injuries. For the mandibular premolar image, we want to cover with the film packet the entire canine, first premolar and second premolar, and part of the first molar. Place the film into the floor of the mouth and look through the ring to make sure that the mesial aspect of the canine is covered. This is one of the most challenging films to get anatomically. You want to be as parallel to the teeth as possible and still see that the whole canine is covered with the film packet. This Dexter had tori, so we moved the film closer to the tongue and then forward in order to get that mandibular canine covered. The central beam should be directed through the contact area between the first and second premolars. The point of entry is the line from the pupil of the eye to the mid-mandibular area near the root apices. You can align your vertical and horizontal angulations and bring to the ring. The operator will exit and press the exposure button and quickly go in and remove the film from the patient's mouth when finished. Place the exposed film in the disposable cup on the tray and pick up the next film, which is the left mandibular molar periapical. Recalibrate at the control panel for the mandibular molar periapical icon. One of the things that helps with this film placement is to feel how deep the floor of the mouth is by putting your index finger on the linguals of the molars. You can tell the patient that this is where the film is going to be placed. You want to look in the patient's mouth and evaluate it. This patient has partially erupted third molar, first and second molar, and we will be getting the distal of the second premolar in the image. We're going to go in flat, then place the XCP straight up and down so that the film is parallel with the lower teeth. You can retract so that the back of the bite block is against the inside of the cheek. Lower the XCP to the floor of the mouth and have the patient close. Let the patient know that you will work with them so that you find a comfortable spot and we can get the necessary image. Look through the ring. The central beam should be directed through the contact area between the first and second molars. The point of entry would be the outer canthus of the eye, dropping straight down and rolling just over the inferior border of the mandible at the height of the apices. We should see this area within the center of the ring. Align the vertical and horizontal angulations and bring to the ring. Evaluate and exit the operatory to make the exposure. Clear! Quickly go in and remove the film from the patient's mouth. Place the exposed film in the disposable cup on the tray and pick up the next film. We would be moving on to the upper left quadrant. The tube head is in the correct position, but now we have to flip the XCP instrument to accommodate the maxillary quadrant on the left side. We're going to put a new film in, dot down, and white is right. And now our XCP setup is correct for the upper left and the lower right quadrants. We would proceed and take the premolar and molar image for the upper left quadrant, and then the premolar and molar images for the lower right quadrant, utilizing the film placements previously seen in today's session. Be sure to recalibrate at the control panel prior to each exposure.